Y'all, we made it to part 5. Welcome back. This is the ADPIE series. If you're new here, hello, hi, welcome. My name is Judith, and I'm doing an ADPIE series to make sure that you understand ADPIE and your nursing process so you can ace nursing fundamentals. Assessment, diagnosis, planning, implementation, and now evaluation. Hallelujah. This is the step that I think most nurses and nursing students make an afterthought, and this is actually what makes nursing a loop and not a line. This is important because evaluation is where you find out if your planning and implementation actually worked. If I want to get technical, evaluation is the systemic comparison between the status of what your patient is now and what they started out with when you first assessed them. The patient is going to maintain an O2 stat of 95% for the entirety of the shift. At the end of the shift or at regular intervals, you ask yourself, did the patient meet this goal? Did they actually meet it? Did they partially meet it? Meaning, did they only meet it 2 out of the 3 times that you checked during your shift? Did they meet it throughout? That O2 stat not seeing 95% at all. Depending on your answer, your next move is different. And this is why SMART goals matter so much. Because if you can't measure your goal, you can't tell if the outcome was successful, and you can't adjust as you need to. So when you're evaluating your patient, there are 3 possible outcomes. 1, your goal is met. Congratulations. Your patient maintained their O2 stat at least 95% throughout the entire shift. You've documented it, you assessed it, it worked. But you don't just stop monitoring, you continue to monitor. Outcome 2, your goal is partially met. The patient maintained an O2 stat of 95% 3 out of the 4 times you checked on them. Or maybe they got to 93% throughout the entirety of their shift, which is some change, but not significant enough to meet your goal. So something worked, maybe just not enough. At this point, you revise the plan, you adjust the implementations, or you adjust the goals if needed. Now, outcome number 3 is goal not met. If the O2 stat was at 89% when you started and it's still at 89%, then the planning and the interventions just didn't work throughout. That means that you go back. Was the assessment complete? Was the goal realistic? Were the interventions appropriate? You don't necessarily stop, you readjust. Don't forget to document. Evaluation is just as important to be documented as the implementation itself. In your nursing note, you are recording. What was the goal? Was the goal met? What did you observe? What was the overall patient's response to your interventions? I'll give you a good example of a good evaluation note. Goal partially met. Patient maintained O2 stat of 95 to 97% on 2 liters of nasal cannula throughout the entirety of the shift, following repositioning, breathing exercises, and scheduled albuterol. Patient still on supplemental O2. Will continue interventions and reassess at insert time here. This note is so good because the note tells the next nurse where the patient is at, what worked, and why the plan is what it is. And that's continuity of care, and that's a proper evaluation. So let's talk about this loop that I keep mentioning. Let's talk about how ADPIE actually works in practice. In a real clinical moment, you walk into the patient's room. Assessment, O2 stat at 88, respiration rate 24, crackles bilateral. Patient is short of breath. Diagnosis, impaired gas exchange related to pneumonia as evidenced by the assessment I just said. Planning, maintaining O2 stat at 95% and above by the end of the shift. Interventions are ahead of the bed at least 30 degree angle. O2 therapy, their scheduled albuterol and breathing exercises. Their implementation, you do all of those things. You educate your patient and you document. 2 hours later, your evaluation is O2 stat at 94%. Not at the goal yet. You loop back. New assessment. Has something changed? Is there something else going on? We adjust the plan. Does the plan need to change? You implement the revised plan and then you evaluate again. Perhaps they need a little bit more O2 supplementation or just longer time. That's the loop. It's running continuously. It does not stop just once. And that is ADPIE, my lovies. Assessment, diagnosis, planning, implementation, and evaluation. If you watch this through the whole series, I want to say something to you. Nursing school is hard. Being a nurse is hard, but you got this. You can do this. Your clinical thinking and your critical judgment are developing. You can do it. Stick with it. As you get more seasoned in what you're doing, it will become easier. I hope you found this useful, and I'll see you in the next one.